Hi, welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Kathleen Muldoon. She's a healthcare coach. Today's Kevin MD article is The Cost of Presence, a Lesson in Listening. Kathleen, welcome to the show.
Thanks for having me.
All right, so just briefly share your story and then talk about the events that led you to contribute this article to Kevin MD.
Sure. So I am an anthropologist who works in a medical school. And initially I was teaching basic sciences, anatomy. And a lot of us anthropologists do that as kind of, experts in the human body and evolution and development of the body. And I did that, kind of for a long time. And over that journey, my own expertise was in embryology and had my middle son, my second born son, who was born with a lot of medical complexity with a congenital cytomegalovirus infection. And that just kind of changed my whole view on my role in medical education as someone who has kind of a foot in the community and the disability space, and then also as an educator of future physicians. And so through that, really kind of leaned into how do we talk about things and how do we frame our understanding of all sorts of sort of the hidden curriculum, right, that we call it now in medical education. And that includes how we talk about disability, but also just how do we model being present for each other. And I guess I would say the second time that I was forced into a reflection on my role in this was during the pandemic, when suddenly we're all isolated into boxes like these. And suddenly I had a role to play in kind of the pastoral care of our med students who were trying to do this like really hard thing and navigate these really hard curricula at the same time as dealing with all the things that everyone else was dealing with, the uncertainty and the stress and the stress of their future careers. And so through that, I was given the opportunity to develop a kind of a track of a curriculum that I call the Humanity in Medicine. And it's a course through which we practice having hard conversations. So I'm in front of the med students in lots of different ways, but this is one way. And I've had the opportunity to partner with students and I think this happens in lots of medical schools, like a patient panel might be formed or a patient is invited to come and share their story. And so, the prompt that got me to write for Kevin MD was this one incident now about a month ago where a mom, a caregiver in the disability community here in Phoenix, which is pretty small, even though our city is pretty big. And then within that community, the kind of parent that would come to give this kind of talk is even smaller, right? The advocacy community. So I know this mom, and she's had 6 children, 4 of whom are disabled. And she came and she was going to be coming over a series of weeks to present her story for 1 hour at a time. And I was helping to, navigate the people who were joining online for her talk, but most people were in person. And, in this large space with all these students gathered, most of the students were paying attention, but there's one student just sitting right in front of her who was clearly just working on something else, right? Scrolling through slides, doing something. And I just thought, what is the cost of this, to this person's own professional identity formation, but also to this parent, right? This parent who is there to share her story. And it just got me thinking about like, how do we teach and model presence and that very thing that gives you that authenticity and humanity in medicine that I think we're in danger of losing.
So what happened next after this event in terms of offering feedback to this particular student?
So, in the moment I didn't want to make a scene, but he was clearly in my view and he was clearly in the speaker's view. And so as I said before, I'm a mom and a professor, and I did my best like teacher stare at this student, just like, the international sign for like, stop doing what you're doing and doing better. So I drew up my eyebrows out and I was just staring at him, and it didn't work. And so what I tried to do was intercept the student at the end of the time period, but I was kind of barricaded by the number of students who were trying to leave the room or to say, thank you to the speaker. So I didn't have the opportunity to give the feedback. And so I think that my article is kind of this opportunity, right, to kind of just share the message that, I understand the demands in our time because we all have it. And, everyone in that room had pressures on the time, and I have pressures on my time. But what are we losing if we give up, right, that opportunity to be present and authentically and holistically present to hear each other's stories and let that change us? And I will say the meta reflection for me is I was angry in that moment, right? Because I was experiencing my own trauma as the mother of a child with 42 active coded diagnoses and very medically complex, of all the times where I have felt ignored by my healthcare provider for my son. So in some ways, it's kind of good I couldn't intercept him right now, because I don't know how open I would have been to hear his story. But, you know, we've all met people who think differently than us, that make different choices from us. And I would say, you know, my anthropology training is what informs my ability to learn from those moments, right? To ask those questions and stay curious, because I want to know, you know, what leads you to make these decisions, right? And how do we, because in the long run, it's not the kind of doctor I'm sure that this person anticipates being, right? So this article is my feedback. It's kind of like to the whole community instead of being able to reach that one particular student at that time.
So, speaking from the perspective of a patient advocate, family advocate, child advocate, so tell us the impact when a clinician that you're talking to is present in that moment. Tell us the difference that it makes during that healthcare intersection.
It makes a world of difference. And you can tell when somebody is present to you because they're listening to you and they're taking your own individual circumstances into account. And that makes the world of difference because you feel seen, you feel heard, and having the answers is not what a parent like me looks for, because we know that not everybody's going to have the answers all the time. And I don't think that most parents expect a doctor to have all of the answers right away. What we want to hear is a willingness to ask the questions that center us and our experience, and to take that in and truly see us. And if you don't have the answers, say, I don't know right now, but we're going to find out. And that partnership, I think, means a world of difference and makes the difference between a parent that is seen and adheres or complies, or whatever the term you want to use is, with the treatment plan, but feels like a true partner and has that loyalty to that person because you know that they're going to see you and center what's best for that, you know, person, or in this case, my son, in that moment. And I think that that kind of trust means the world of difference.
As we know, attention is becoming a limited and scarce resource, right? And you have increasing amounts of distraction. Of course, you have like scrolling apps, social media, you have all these digital devices that really takes away from being present. So,
there's a tension in medical education, right? It feels like, especially as more knowledge is gained, that we want to impart to the students and have in the first 4 years of their training, which is where I specialize. We just put more and more and more in, right? And the problem with that is that there's no, you know, excretory system in medical education, right? So you do get distracted, not only by the distractions that we all have, but by the tests in front of you and the, you know, the mounting pressure. And that is a very real thing, right? And how do you balance that against being present to your own self in addition to the person in front of you and your own humanity? And I think that that is where we're all kind of struggling right now. And I don't have the answer. I'm modeling this for you now. I don't have the right answer. But what I would say is listening to yourself and knowing when you are yourself out of balance with how you face kind of the chores in front of you, with how you face your ability to pause and listen to your peers, your patient in front of you, your professors, whatever discussion space you're in, to the moment, is, I think, the thing that we're not practicing enough. And I would suggest that being present, like many of the other clinical skills, is a muscle that you develop. And the more that you practice, right, just being intentional with your space. And I know, like 15 minutes a visit, you know, and just turning over and you know, all of the pressures and the EMR and all the things that are mounting up, having those things balanced against your ability to kind of use those 15 minutes, you know, to be present, is a real problem to look at from multiple angles. So the more that you practice, what are the ways in which I can show my presence, even in a small portion of that time, right? And be present to my own emotions, what comes up for me when I am present. I think those are the ways forward. And once you start practicing that muscle, it's just going to keep building and building and building.
Now, you mentioned that you teach a lot of medical students about how to navigate difficult conversations, how to be present. So, what are some of the tips that you share with them during this time with all the distractions and navigating difficult conversation?
So I try to remind everybody that, we approach these conversations from a place of curiosity. And what we're seeing, I think, nationally is that everybody wants to put another person into a box, right? And that is a way to distance someone from them. But there, are so many philosophies, so much research now that shows that when you can see to the core value of another person across any kind of divide that might be in front of you, that you can make that connection, right? And so what we practice is especially when an emotion comes up for you because you disagree with somebody, or somebody's not being compliant, or they're challenging you, stay curious about why is this person acting this way? Like, what I see is that core value. And so, we even do exercises through a course I teach using improvisational theater techniques, like, this is my friend so-and-so, and they are somebody who values time efficiency, right? Or money, or whatever it is that you could be kind of like what the challenge is coming up, or being seen in medicine, right? And then you can respond from a place, well, I'm also somebody who values those things. So how do we move forward in this conversation? So it's a way of saying that you identify with a person, not necessarily their idea or their behavior, but the core value, because we have so much more in common than we might suspect from the way that things have become so polarized and divided.
And you mentioned polarization and division, and that's all the more important because in the current political climate, there is an increased distrust in medical experts, right? So I think some of the advice that you share here is actually silly, not just in, of course, the medical education standpoint, just in medical settings in general.
Yeah, and then within medical education, within the larger climate, right, that we're in a situation right now where I think we are training future doctors to be brave in multitudinal ways. And so practicing that skill of courageous conversation, of moving things forward and being present to the person in front of you, I think is ever more important right now.
Now, is there a success story that you could share? And it doesn't have to be in the paradigm of medical education. It could be through your coaching practice where you implemented some of these techniques in an individual and it really moved the needle in terms of how they better stayed present and better communicated with patients.
I mean, I think I've had the joy of having several, and so the course that I teach on courageous conversation is a mandatory course in the first year curriculum at my medical school. And there are some people, as you know, probably, that is sometimes can be like a divide between what's a hard science and what, is typically considered part of medical training, biochemistry, anatomy, physiology, versus the softer side, right? The more clinical skills. And so there are sometimes students that are openly, hostile against taking this course of these.
What does that look
trainings.
like when they're openly hostile?
It looks like disengaging from the conversation. It looks like phoning in their responses to the discussion. So I implement kind of like a reflective writing practice, both as, again, to practice the skill and how do I process my own emotions from this conversation, which has been demonstrated to decrease burnout the longer you're in training. It looks like sometimes putting an armor on from which you are not seeing the person in front of you. And sometimes that is previous experience. A lot of med students come into school now with work as a scribe or a EMT or, previous experience. And like, I know how medical systems work. Like, this is how it is, right? And unwilling to hear a different side of the experience, especially from a more minoritized person in the system. Sometimes it looks like putting your faith on as an armor. And so that's what kind of disengagement can look like. And one success story is that I did have a student who was very much like that this year and was, for lack of a better word, forced to be in community with me about these issues. And the more that I could engage with this person and see through to them that you are my friend and we share this core value that medicine is worth the hard parts and worth looking at all the underside in order to make it better and move it forward. We just have different opinions on how to do that. The more that we practice it, he is now the biggest proponent, one of the biggest proponents of this course, and takes some of the group rules for our discussion and the practices that we've implemented in order to see everybody in front of him in a different way, and not necessarily like shifting anybody's position, right? Because we need that diversity of thought, but being open to the invitation, to the discussion, and then also the invitation within yourself to say, you know, well, what's coming up for me in this conversation? Why am I finding it hard? And so I'm just so proud of this student for meeting that invitation and taking on the challenge, because it isn't easy for anyone to do that. No one, it's easier to distance a problem, right, than to kind of engage with it. So I consider that too one of my greatest partnerships.
We're talking to Kathleen Muldoon. She's a healthcare coach. Today's Kevin MD article is The Cost of Presence, a Lesson in Listening. Kathleen, let's end with some take-home messages they want to leave with the Kevin MD audience.
You know, my take-home message is that, you know, what are we giving up if we give up that willingness to be present to each other, even when we have distractions and, you know, other demands on our time? My call to the community is that we make each other and our system stronger by being present to each other even in discomfort, and to lean into that, and it, you know, will always be worth it.
Kathleen, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thank you so much.